All right, hello everybody. I wanted to thank everybody for jumping on this webinar and listening to an exciting new health option that OCI is bringing to the agent base. This is Gig Care. It's offered through Population Science Management. We feel this is going to be a really nice option to have in your arsenal going into the 2026 year with a lot of what we're seeing from a rate perspective in the different states. We're seeing very high rate increases, a lot of changes to the subsidies. So the advanced premium tax credits going away over the 400% FPL. Short term is an option, but we think that this does have its niche, especially with 1099 workers. So this would be for people that don't have any options through their employer, probably aren't subsidy eligible, and still looking for a full-blown health insurance option. So we've got a couple different speakers today to explain a little bit more about gig care, how people would sign up for it, how they qualify. There is some nuances that we just want to make sure that everybody's aware of, and answer any questions that people might have, and hoping this clarifies some of it. Again, I do see this fitting for people that are over age 50, just based on the premiums. Um, again, people that aren't subsidy eligible and typically a healthier population. And I know our speakers are going to get a little bit more into that as because there is some suitability questions for them that they do have to answer in order for them to qualify for the health plan options. So again, people that have higher incomes, healthy, probably over that age 50, I think this is going to be a really good option. One of the nice things too, and I'll get to it right and early, is the compensation on this is extremely high as well. So compensation starts at $85 per contract per month. So you compare that to some of the ACA, where typically you're looking at about $20 per member per month. You sell a few of these, and this is definitely going to boost your income as well. So it's available in most states. There are a few caveats, and I'm sure our speakers will get into that as well. A lot of the information on the plans itself can be found on our website at www.ociservices.com/gigcare. There you're going to find all the certification, the paperwork, um, the forms, premiums, all that good stuff. So again, just visit out at that website for more information. So with that, I'm going to hand it over to Clint Williams. Clint is with Blue Cross and Blue Shield of Nebraska. They are utilizing the gig care plan is utilizing their network. And so they want to talk a little bit about where they fit into this. And we're excited to have everybody on today. So with that, I'm going to go ahead and hand it over to Clint with Blue Cross.
Thanks, Nate. Appreciate that introduction. And thanks, everybody, for joining us for this webinar to talk about gig care and how we are working with them. So my name is Clint Williams. I'm with Blue Cross Blue Shield Nebraska. I've been with Blue Cross for several years. I've worked mostly as our overseeing our pharmacy department, but also work as our small group market segment leader, and also have been supporting this particular product as well. So at Blue Cross, we have several products that we've developed over the years, and really our goal is to find products that meet the needs for as many customers as we possibly can. And we think we've done that with all of our products. But in this particular product, as Nate mentioned, we've found a niche that is in an underserved population that we think this can really fit nicely with. And so Nate mentioned a little bit about all the changes in healthcare. I think most of us have seen a lot of the headlines with a lot of health carriers talking about how claims have been really high, and that there's just going to be probably a pretty significant shopping event this year as people look for what is going to be best for them. And we think this fits a niche that we'll get into here a little bit later. But first, I just want to talk a little bit about what attracted us to partner on a product like this. So they say sometimes opportunity is born out of circumstance and necessity, and that's kind of how this started. We were approached by someone who was looking for the ability to be able to support some W-2 agents that they were converting to 1099s, and this fit really well with that. But that's just one example. If you look at the state of Nebraska, and I've gotten this information from the Small Business Administration, there's about 145,000 people in the state of Nebraska that are 1099s or sole proprietors. So there's a big opportunity for people that are looking for different options other than say like something through the ACA or even other products as well. So and some of the key industries are like real estate agents, construction, professionals, things like that. So there is a pretty significant opportunity out there that we think this product can help a lot of folks find coverage that fits them and is affordable. So why Datego? So they have this working owner model that Ken will talk about here shortly, that they had developed, and it really fit this niche really well. And so we had been working with them to provide access to our network, which is pretty key for a product like this, and gives it a lot of advantages that you wouldn't find with other products that are out there. And then we also perform all the pharmacy management and help provide those benefits as well. So the last thing I say, why work with OCI? Well, they have a long history here in Nebraska and a partnership with us, and they really believe in this product and how it can fit with a lot of different customers. And we also feel like they have a lot of good resources that can help pull this through. So we're really excited to be working with both Datego and OCI on this, and also you as well, so that we can help all of our customers to find solutions that really help them in what is kind of a interesting time that we're going through right now. So with that, I'm going to turn it back over to Ken so he can talk about the product in a lot more detail. So Ken, I'll let you take it away.
Thank you so much, Clint, for the great comments from your perspective at Blue Cross Blue Shield. Blue Cross Blue Shield certainly is a powerhouse, and we're very grateful to have access to the network that really helps members get access to great quality providers right in their backyard. So yeah, thank you for everyone joining today, and maybe to just pick up a few things. So what we want to cover today, and maybe we can go to the next slide here. So this will be our agenda for all of you today. So we want to cover what is the product that is being offered in the market. It is different, as you heard, maybe a few comments from Nate and Clint. And then we also want to talk about what is the role of a member who joins this plan, and be really clear about what your role is as an agent and a recruiter. And we'll talk about the distinctions there. I'm going to turn it over in a little bit to my colleague Gentry Roan, who will go through the gig care plans. They are a PPO, and there's several options that'll meet your client's need based upon price and deductible. And then we'll talk a little bit about the back office and Datego and the TPA that are being brought together to make this product come to life. So we hope we'll be brief, we hope we'll be brilliant, and we hope at the end we'll be gone and you will be on your way to having a great journey, being able to sell and recruit members under these plans. And as both Clint and Nate said, this is a very exciting time for agents and brokers. Many changes in your members need you. They need you as your guide. And so we hope to help you in that journey. So what we'll do, and then next steps, please, if you wouldn't mind going to the next slide. Okay, cool. So basically, long story short, the 10 years ago, you sold different plans than you are today. Tomorrow and 3 to 5 years from now, there'll be different plans being in the market. So the market and the needs of the consumer are shifting. There are more 1099 gig economy workers than ever before. I think I've seen latest studies of somewhere north of 25 million Americans are self-employed. They own their own business. Maybe they're a one-person shop. They don't offer group health plan, and they're not available to be on an employer-sponsored health plan. So that's the niche. And what they're looking for is they're looking for a plan that's customized to them. And so we believe, and this is why we're here, is that we want to offer an incredible product that really empowers the agents and brokers to get out there and talk about something newer, something that's different, and something that's really geared to self-employed individuals, generally making more than the average and generally healthier than the average. And we'll talk about that as we go through today. So that's our why. The product is called Gig Care. That's the name of the product. The employer who employs individuals is called Population Science Management, or PSM. It's a large employer. There's over 120,000 covered lives through Population Science Management. And we've established over the last 3 to 4 years the legal framework that allows an individual to legally join in a compliant way a large employer plan. And so that's where we're going to start distinguishing the fact that this is not an individual health insurance product. It's actually geared for 1099 individuals who can participate in a large group offering. All of this is governed under ERISA. All of this is something that we'll go through today. But it's important to understand that with the Blues Network and Clint on the phone and with OCI, this is a very great opportunity to really dig in and learn more about this to help more of your members. Quick personal story. I live outside of Denver. And as you know, many of the carriers are having higher rate increases. One of the major carriers actually pulled out of the ACA. In Colorado, there's 100,000 people who live in the Western Slope, just west of Denver in the mountains, who are losing their coverage because those carriers or those plans can no longer service them. So this is, again, folks, this is a great time. So thank you so much again for joining us today. Next slide. The team here, we won't go long, but we're here to support OCI, and OCI is here to support you. So our team consists of myself, Gentry Roan, Brandy Bjornson, and Tracy Krause. So if and when there's any issues that you have on the product, OCI will contact this very committed, seasoned team that's been in the business and all around healthcare, health tech, and bringing transparency and better plans. So next slide, please. Okay, so I'm just going to do 2 more slides. So I want to, this is the subtitles of the agenda. So we're going to talk about the working owner model. And then we're going to talk about CDR, which stands for Consumer Data Respondent. And then we're going to talk about how members can enroll. And I'm going to share that conversation with Gentry. Next slide, please. So the working owner model. So basically, an individual who's a 1099 employee, self-employed, can access a large group health plan through Population Science Management. And the relationship between the two are as follows. An individual agrees to share de-identified consumer information. So we're looking for people to share various information around their preferences of consumer products. So PSM is a data research analytics company, and its mission is to understand behaviors in the population of generally healthy people. If you think about it, there's all sorts of information available around various diseases, chronic condition states. So there's a ton of information about various condition states. There's not a lot of great information about what does the average American consumer look for in various products. So that is the relationship. An individual would agree to become a consumer data respondent, and in that role, they become a K1 working owner of Population Science Management, and then that unlocks their ability to enroll in the group health plan that's offered through Gig Care. Okay, so that's the relationship. Maybe next slide, Gentry, if you wouldn't mind, please. So key points. Nate appropriately said that this is a higher commission schedule that's afforded to individuals who are authorized to sell these products. So number one is this is not individual health insurance. It's a large group employer plan being offered to individuals who are willing to engage and share various information on a monthly basis. And in that role, they gain access to the group health plan. So that's number one. Number two, because you're not just selling insurance, you're actually playing a very key role in helping recruiting future consumer data respondents in this model. And at the end of the year, members receive a K1, which is a certain class of ownership. So they don't need to work full time. They only need to complete some surveys throughout the year on their mobile app, which we'll talk about in a little bit. So you're looking at this saying, how do I help my members? What's my commission and how do I enroll members? So the point is that really to understand that you're a key role in this equation. We trust that OCI has done a great job in their side training and providing education and support. But it's critical that people understand that when you're talking to a member, there are certain responsibilities that they have as a consumer data respondent. And because you're doing more than just enrolling them in a plan, you're actually recruiting them. That's how we're able to have a more competitive commission than the general products that are out there today. Okay. Next slide, please. So I talked a little bit about PSM. The surveys cover a range area of topics ranging from lifestyle to consumer insights. And that is really what PSM's mission is. So again, large employer, it is a fiduciary as a health plan. So you'll learn more about some of the cost containment, but the product's been running very well. Members have really enjoyed the program, and obviously there's a great opportunity for all of you on this call. Next slide, please. Okay. Gentry, I think I'm going to turn this over to you and then take us through the next few slides, and then I'll join at the very end for closing comments.
Excellent. Thank you, Ken. So again, my name is Gentry Roan, and I am going to talk a little bit more about the working owner model and then get into the gig care plans specifically. So as Ken mentioned, when members become a working owner, they gain access to the group health plans, group benefit plans available through PSM. So a few highlights on those plans. Each plan option has national network access through the Blue Cross Blue Shield of Nebraska network. All plans are ACA compliant. All plans do include telemedicine services that include virtual primary care, virtual urgent care, as well as some additional mental health services. And of course, all your plans are going to cover your ACA preventative care services at 100% through an in-network provider. There's also some ancillary services or add-ons, I'll call it, and we'll talk more about later in the presentation as well. But some of those services are, there is a company called ScriptAid that is included in every plan, and they provide pharmaceutical advocacy services to the members. GuideCM provides the utilization review and case management services. There is another company called NaviClaim that is basically a high-level member concierge service. That's your member advocates. They'll handle any surprise billing or potential provider contracts and negotiations if required. And then, of course, Tatego Health, who we'll talk more about later in the presentation, who is the underlying claims administrator for the plans. Okay, so before the benefit plans are ever presented to a member, there is a suitability process that has to occur. And this is very, very important. So what is suitability in this sense? This is where you as a recruiter are making the determination if a prospect is suitable to become a working owner for PSM. And this is done through a prospect assessment questionnaire that you will find in your E123 back office. It's a simple questionnaire that asks, I believe it's 11 health questions that you're going to use to basically determine, is this prospect healthier than average? right? Because that is who PSM is looking to employ to provide consumer insights as a consumer data respondent. So again, this is a very, very important part of the process, and it is really the first thing that you are doing as when you're meeting with a prospect. So this has to occur prior to those plans ever being presented to the member. Another item to note that's important to think about while you're making the suitability determination is that none of the PSM or gig care plans cover specialty medications. So if there is going to be a question on that form that's going to determine as well if the members on any meds that aren't eligible, but this is important to keep in mind because the plan's not going to cover those meds. So if you know the members on a high cost injectable or other specialty med, they're automatically not suitable. Okay, so now you've made the determination that the member is suitable. What are their job requirements? Really, they have one primary requirement, and that is to complete the surveys that are pushed out to them monthly. So they'll receive 10 to 12 surveys per year. Those surveys are made available through the Covered 365 app that we strongly encourage you to push in the beginning and encourage the members to download, because they do have to complete those surveys to maintain their eligibility status. But that app also serves as their member portal. So they're going to have access to anything you would typically see within a member portal, digital copies of their ID cards, their full claims history, EOBs, etc. And again, those surveys are published monthly. They're short surveys, 2 to 3 questions, and they're really just questions on primarily focusing on general lifestyle behavior. So the working owners do get paid for completing the surveys. Those payments are $10, and those payments are made through Commerce Payments Preferred Pay. This is also done through the app. So members, if they have not set this up yet, they will receive emails from Natago Health advising them to set up the payment method. But of course, again, this is very important. If they're going to be doing the surveys, they might as well be receiving payment for them. Okay, so now going into the plans themselves. As mentioned earlier, the plans are branded Gig Care. They all include national network access through the Blue Cross Blue Shield of Nebraska network. The plans do use the PDL-10 and PDL-40 formularies, if anybody is familiar with those. And also, in your E123 back office, there will be direct links to the provider lookups as well as the formularies. All plans, the rates are age banded on, and there's 4 separate age bands, which you can see here. And there are 5 plan options in total, 3 of which are PPO plans, and there are 2 EPO plans as well. So here is a very high level overview of those 5 plans. So the first 2 with the lowest deductible options are PPO options. Those are your $1,500 and $2,500 deductible options. You'll see the co-payments are very similar across the board for your office visits, urgent care visits. The out-of-pocket maximums are also very similar. Obviously, the primary difference between the PPO and EPO plans are that the PPO plans do include out-of-network benefits. And as you'll going a little more to the right here, you'll see the 2 EPO options. Those are your $5,000 and $7,350 deductible options. And then there is a $5,000 HDHP or HSA compliant plan as well. So that is a PPO plan, but of course, being a high deductible health plan, there are no co-payments. Everything does go to deductible first. And you'll also see we have in red just another reminder that none of these plans will cover specialty medications. We do also currently have 10 no-sell states. So as you'll see on the map here, any of those states in blue, these plans would not be available to the members. Now, an important item to note here, because we do receive this question a lot, this is for the subscribers, right? So for example, I live in Ohio. So I would be eligible, assuming I'm suitable, I would be eligible to join the plan, but let's say I have a dependent that lives in Pennsylvania, which is a no-cell state, they can absolutely still utilize the plan and services. It's just the subscriber, the primary, who is being signed up as the working owner, cannot reside in one of these states. And this is also in your E123 back office as well, too. You'll see it on every product tile, and also if you were to try and enroll a member in one of these states, the system would stop it. Okay, so some highlights, and going back to the additional services that are included in the plans. So as I mentioned, we do have a telemedicine provider that's going to provide you 24/7, 365 days a year access to primary care, urgent care, and there are some mental health services included as well, and that company is called MyLiveDoc. There is also a diabetic solutions vendor called DiaThrive. So that is going to be basically for any members who meet the criteria, they could qualify for certain diabetic supplies at no cost. It's also a disease management program, so they would have to participate, be compliant with the guidelines to make them eligible to receive those supplies. And the plans do include a service called green imaging as well. So if anybody is not familiar, I always refer to this is really, it's not a network, but it's almost like a small network for imaging services. So if you know that you have a scheduled MRI or CT, etc., and you don't want, maybe you haven't met anything toward your deductible yet, you could reach out to Datego. They can get you in touch with Green Imaging, and they can work with you to schedule you with a Green Imaging provider for that procedure, and your deductible member responsibility would be waived. Okay, and then the plans also include ScriptAid. Now, this is very important. This is the pharmaceutical advocacy service. So as I mentioned a couple times, the plans do not cover specialty medications. That does not necessarily mean that your member has no solution or help with their prescriptions. So really how this works is there are 3 different programs that they'll work with the members on. The first one is the personal importation program. So this is going to be for any covered medications. If that medication is available through one of the Canadian pharmacies that ScriptAid works with, they will do all the legwork. They'll take the member's prescription, coordinate it with the pharmacy, and they'll set it up to where they can receive that medication sourced and mailed directly to their home for no cost. So the incentive to the member there would be a waived copay. They also will work with manufacturers on the patient assistance programs. So basically, if a member has a high cost medication and there's assistance available through a manufacturer, ScriptAid will work with them to determine if that member qualifies. And if they do, again, they'll set it up to where that medication is shipped directly to the member's door for free. And the last one is the self-pay importation program. So this is going to be strictly for non-covered meds. So let's say a member comes on the plan, they are diagnosed with a condition that requires maybe a specialty med or another high cost med that may not be covered. ScriptAid will work with that member and they'll do some research, and let's say they do have this medication available through one of the Canadian pharmacies and it's a fraction of the price. They will again set that up for the member, so the member doesn't have to do any work, but the cost for that medication would be passed through to the member. So rather than paying full price, they may only be paying 30 to 40% of the cost for that med. So that assistance is still available to them. Okay. There is a monthly cutoff of the 18th of every month for any enrollments. This is just to ensure that the members can go through the files, get loaded ID cards, everything is available by the 1st of the month. All enrollments are done through E123. So if you're not familiar with E123, it's a really nice tool. You'll have your own login, your own back office where you can manage your members. You have your own sales site, which we have set up. It's broken out nicely by plan. So all the marketing materials, SBCs, those provider lookup and formulary links are all included with E123, so you can easily navigate and review with the members as you're meeting with them and really screening them for one of these plans. Okay, so with that, I am going to go ahead and kick it back over to Ken, who is going to talk about Datego Health, who is the underlying TPA for the plans.
Thank you, Gentry. So maybe just to summarize what we've heard so far. So effectively, as an agent for individuals who are 1099, you're acting as a recruiter to see if they are suitable to become a consumer data respondent. And that role means they have an obligation to complete surveys on a monthly basis using an app. In doing so, then they unlock the ability to become a working owner and a class of shares in a company that allows them to be a K1 working owner. And after all of that, then you enroll them in the group health plan, which is just what you do on any other day today. But those are the two main distinctions: is your role as a recruiter and the individual's role as a consumer data respondent. So again, that's sort of where we've been. I want to share with you a little bit about the Datego story. So Datego is a licensed TPA, been around for 4+ years. Really, the mission and the vision of the company was established to see if we couldn't simplify healthcare, allowing individuals to have a better experience, unique offerings. And the product, is our friends at Blue Cross would say, is it blew up really in the last year. From 5/1 through 1/1 of 25, 5/1/24 through 1/1/25, there were over 17,000 individuals who joined Gig Care. So it's clearly meeting a niche that the market is interested in. We now have grown from sort of the early days to over 120,000 members. We have over 150 employees, and I think by the end of this year we'll process somewhere north of 450,000 claims. So we're a mighty force for good, changing healthcare as we know it today, and excited to join you today to talk more about that. Next slide, please. So this is some of the leadership team. Richard and Alan are the co-founders. Richard spent many of his years as a hospital consultant and then was CEO of Cancer Treatment Centers of America. Alan Wilson, IP attorney, also worked at Cancer Treatment Centers of America. So they're the visionaries. Jill Schroeder is in Omaha. She leads an incredibly committed team, and we're growing and we're investing significantly in quality employees to have quality interaction with our brokers and members. And then Kerry Hall's also a co-founder, and he's out of Kansas City. He's a former broker, and he's out there. He has a nationally syndicated radio station that he's on many different podcasts and stations across the country. But this is the leadership team, again, over 40+ years of healthcare experience. Next, I think, and final slide. Going to wrap it up here. And then I'm going to turn it over to Nate. So maybe some final thoughts. So I'm not in your shoes. I'm not an agent. I'm not a broker. I've been working with distributors and agents and brokers my entire career. You are critical for the success of these plans. You're the tip of the spear. We're expecting you to become educated. There is a test, and then there's a video that's available that you can receive through OCI to learn more. But here's what I would expect if I were you. I would expect that I'm going to invest a few hours to really get my arms around the plans, to understand the talk track about how this works. Contact OCI if you need any additional support. But you know, every one of you live in a community and every one of you knew at least probably 10 to 30 realtors. You probably know a few property and casualty insurance agents. You probably know a lot of hairdressers. Anyway, the point is target people you think would be a good fit for PSM. Educate them on the model. So this is a product you can join where you actually become a K1 owner. In addition to your role as a self-employed individual, you need to complete some surveys, and that's really the backbone of the agreement. The members would receive a joinder agreement so that they receive the ownership benefits in population science management. But it's really important that people should know clearly this is de-identified data. This is not shared, this is not resold, this is anonymized, and everyone can feel confident that their survey or their information is being protected. Again, we talked about this is not individual health insurance. This is a large group health plan. Ensure that the members know that they're recruiting you, member, for a role as a consumer data research, CDR. And if they qualify, then you will guide them through an enrollment process to have them access the group plan that best fits their needs based on their budget and also which product is best. So as you always do, standard of care is #1 priority to ensure that the members receive the right plan, that they understand the product, and you're guiding them through their journey. Iron Health is here to support OCI, and OCI is here to support you. And I guess the final point would just be you will have questions, and we expect that. We have great resources available on E123 and afforded through OCI. But as you move into the open enrollment season in this fourth quarter, we really wish you happy selling. We'd love to have new agents come on board to learn and start selling the products. And so we're grateful to be here today with Clint and the team at OCI. And I'm going to turn it over to, I think, Nate for final comments. Thank you, everyone.
All right, I just wanted to thank everybody for listening to this video. I want to thank Clint from Blue Cross and Gentry and Ken from Iron Health as the back office to the Gig Care product. As you've learned, I think this is a really good option for any of your 1099 people, probably over the age of 50, in good health and typically not subsidy eligible. Again, not eligible for anybody's group plan or an employer plan. So I think again, with the high compensation of starting at $85 per contract, definitely something to have going into this next open enrollment. I think one of the other things that I didn't mention at the beginning is with the ACA plans on the exchange, you are going to see most of them. I mean, the days of PPOs on the exchange are kind of foregone. Everything's gone to an EPO or an HMO. And some of your people are limited from a network perspective. So if you do have individuals that want to look at that national coverage, this plan is paired with the Blue Cross Blue Shield of Nebraska National Network to give them access around the country. So I think what the next steps as to how you go ahead and get set up for this product, again, everything can be found here on our website, ociservices.com/gigcare. You'll see in there is a short little video that you will need to watch. Right on that front page, you'll need to watch that. Upon completion, there is a certification test you will need to complete. I think there's only 25 questions on there, so you'll answer that. Upon a passing grade, you'll receive a notification from our team here at OCI that you've been approved and certified to sell the Gig Care product, along with your credentials to log into your back office. So there you're going to be able to see all of your members, your book of business, pull up any additional forms. You'll also on that platform be able to receive your actual unique URL that you'll actually use to enroll individuals into the Gig Care product. So again, you'll need to watch the video, do the certification, and then get access to your back office. I think with that, if you have any questions, please reach out to our individual team. The email address is here on your screen, individualadmin@ociservices.com, and we can help answer any further questions you might have. Again, I want to thank everybody for their time and enjoy the rest of your day.